Hi, my name is Erin Manzi. I am a staff nurse 3 on 9 East. I completed a poster for the behavioral health education for nurses on strategies for rapid adoption in pediatric inpatient medical units. Boston Children's Hospital recognized the influx of behavioral health patients on inpatient units and the need to help nurses to be able to interact with these patients. With that, they actually were able to purchase the WELL platform and educate staff on behavioral safety and management techniques throughout Boston Children's Hospital in several different disciplines. I, alongside 2 of my peers, took on the medicine patient services part of it. We underwent a 32-hour comprehensive training program, and together we were able to put together a program where we were interacting with staff from the 3 medicine patient units. We were able to take the 32-hour comprehensive training and condense that into a 4-hour-long program. Every person was given a booklet, and together we along went through all of the education that we had learned in de-escalating situations. And then the other half of the program, we were able to teach skills to help us in different situations where we may need to safely exit a room or help patients get back to their rooms safely. Together, we were able to educate all of the staff within MPS in a very short amount of time, basically in a 3-month period, which was over 200 staff members. The reason we were able to do this, I believe, was we had very good ability to book areas where we had enough space, and we had a list where people were able to sign up through a Google Docs, and we made sure that all of our staff were participating, and we gave them deadlines. I think what made our program really successful was that we were 3 nurses from 3 different areas with 3 totally different personalities that brought a different spin to each thing that we taught. We made the class as interactive as we can, and because the 3 of us were staff nurses on the floor, we utilized actual situations, which made everyone adopt the WELL program. So we weren't used to having mental health patients on our units. We were medical nurses. These kids were getting basically here for weeks waiting an inpatient placement. It was nice to be able to recognize behaviors that they were having and bring them back into their green zone. And what we did find, utilizing some of the skills that we learned through WELL training and the dialogue that we had learned through WELL training, we were able to bring some of these kids back from their escalation points, where I do feel like prior to our WELL training, kids seem to escalate a little bit more. Having this program has really helped nurses feel a little more safe at the bedside, recognize escalation, and being able to exit rooms before in a safe manner, where before we may have held back and stayed in the room a little bit longer. We developed a common framework and language that allowed our staff to work better together. We could write things in our notes that helped the doctors to recognize, oh, this patient really was escalating, I can see, as they wrote in this note. And we developed a common language. This not only was for bedside nurses and physicians and security, but also sitters at the bedside. And it really was an excellent program. I was grateful that we were able to teach everybody a form of safety, and so that we could decrease the amount of injuries that were happening at the bedside. I'm really excited and hope that the WELL program will continue. We continue to educate the newer staff as they come in, and our bedside injuries really continue to decrease.